we're going to move on to talking about some different types of bladder leakage or incontinence so that you can better identify where your symptoms might fall. So in general, urinary incontinence is any leakage of urine that happens when the person doesn't want it to. So this can be in any amount. It can be something as rare as leaking a drop of urine after doing 100 jumping jacks and being thrown off by that. Or on the flip side of it, it can be someone who has to wear adult diapers and change them several times a day because they can't get it to the bathroom in time. And once they feel the urge, they completely lose their bladder. So there's a wide range in the severity of the symptoms when it comes to urinary incontinence. But research has shown that at least 1 in 3 women will be affected by bladder leakage at some point in their life. It can affect women and people in general at various different ages. We work with as young as teenagers who are dealing with bladder leakage with coughing or sneezing or with their athletic performance, as well as older individuals who are dealing with urgency or leakage with exercise or activity. It really is varied. But the sad thing to me is that only 25% of women end up seeking help about their bladder leakage. Many people think that it's common and that it's a normal part of aging that just happens. I'm here to tell you that bladder leakage is common, but it is not normal, and there are things you can do about it. And hopefully this lecture is the first step to getting you back in control. So one type of bladder leakage is called stress urinary incontinence. And this is the involuntary leakage on effort or exertion. So think about cough, laugh, sneeze, running, jogging, jumping, lifting something. This is the most common type of leakage that people talk about. Risk factors for stress urinary incontinence include childbirth, repetitive stress to the pelvic floor, such as a chronic cough or constipation, and age. So a lot of times people notice as they get older that they can't do the same exercises or activities that they used to do. And so they may not be leaking, but they limit their activity to avoid leaking. So they no longer do any type of jumping activity, or they no longer go on runs. They only go on walks. So this unfortunately leads people to be less and less active because they're trying to protect themselves from experiencing bladder leakage, which is in and of itself a problem. So we want to be able to have people exercise any way they want and not have to worry about their bladder leaking. Another type of urinary incontinence is urge incontinence. This is the involuntary leakage of urine accompanied by that or immediately preceded by an urgency to go. This is often referred to as overactive bladder. You get that feeling, I gotta go, and oops, I don't get there in time. Sometimes people leak all the way on the way to the bathroom. Sometimes it doesn't happen until they get in the bathroom door, or they get right over the toilet and are pulling their pants down. We see it a lot of times when people are out and about and they pull the car into the driveway, and when they get their keys out, they can't get to the door in time because they're having urgency and then leakage. So this is another type of leakage that can occur where people have that urge and can't get to the bathroom in time. Now, mixed incontinence is a combination of both stress and urge incontinence. So someone can have leakage with a cough or laugh or sneeze. Again, that's on the stress side. And they may also have leakage with urgency. And that would be on the urge side. So mixed incontinence is what we call it when there is a combination of both. Urinary urgency is that urgent need to pee regardless of how full the bladder is, but no leakage happens. So you might have just gone to the bathroom 15 minutes ago, but you already feel like you need to go again, and therefore you go to empty your bladder. So an urgent need to pee regardless of how full the bladder is not a common thing. Our bladder is supposed to start to tell us that we need to go to the bathroom, give us kind of a gentle nudge towards it when it's starting to be about half full. And then after that, that urge should continue to increase as we wait out and our bladder gets fuller and fuller. But we shouldn't always be feeling an urgent need to pee. Urinary frequency is when we need to urinate many times throughout the day or at night. At night, it's called nocturia. And again, it's not necessarily a leakage situation, but we're just going very frequently throughout the day. Normal urinary habits are that we urinate every 2 to 4 hours during the day for a total of 5 to 7 times in a 24-hour period. If you are under 65, you should not be getting up at all at night to urinate. Your bladder should not be waking you at night. The only exception to this is when you're pregnant. If you are over 65, once a night to get up to urinate is okay. And then if you're over 75, twice a night to get up to urinate is okay. Anything more than that is getting way too disruptive to your sleep patterns, and we may want to think about doing something about that.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.